Welcome everyone. Thank you very much for joining us on what is the first Instagram live session organized by the European Medicines Agency. And we are here today to discuss a class of medicines known as GLP-1 receptor agonists. These are medicines that are authorized for the treatment of diabetes and for weight management in people who are living with obesity or who have health conditions related to their weight. And who better to discuss this with than my colleague, Bart van der Schueren. Bart is a EMA expert, but he shares his time between Amsterdam here at the European Medicines Agency and Belgium, where he practices medicine. He's an endocrinologist and an obesity specialist. So thank you very much, Bart, for being here with us today. And I thought maybe we could start by asking what GLP-1 receptor agonists are and how do they work?
Yeah. So as you said, the GLP-1 receptor agonists are a class of medicinal products, and they all have in common that they mimic the effect of an endogenous hormone, which is glucagon-like peptide 1, or short for GLP-1. And GLP-1 is one of the incretin hormones. There are several incretin hormones, and what they all share is that they are secreted normally by cells in the intestine. And these hormones kind of communicate from the intestine to the rest of the body when they are in contact, when cells are in contact with food. So they, if you want, announce the arrival of food. And so what happens is that the GLP-1 will communicate to the cells make insulin because food is coming. And on the other hand, it will slow down the gastric emptying so that food can be digested properly, and it will give a signal of satiety to the brain. And so the entire idea behind it is to give a signal regulating blood sugar, and it's why it's used for the treatment of type 2 diabetes, but also giving a satiety feeling. It's a satiety hormone. And so what happened is that the endocrinologist had long time forgotten that the gut was making hormones. But when obesity started to become an issue, and often obesity is complicated with type 2 diabetes, surgeons started operating on patients and started doing, for example, gastric bypasses. And because of the fact that food enters the intestines way quicker when you have a gastric bypass, the GLP-1 response is way higher after surgery. And what we saw was that type 2 diabetes often went into remission even when people hadn't lost much weight yet. And so this is how the idea came about to mimic GLP-1, to make pharmacological treatments based on GLP-1 and other gut hormones to, on the one hand, have an effect on the type 2 diabetes, and on the other hand, help with weight management and help with weight loss.
Thank you very much. So maybe we can talk about it, as you are a doctor, a little bit in the context of clinical practice. What are the main benefits that you see when you're treating patients both with diabetes and living with obesity? And what are some of the risks that you see as well?
So the main benefit in people with type 2 diabetes is that GLP-1 agonists regulate blood sugars when glucose is high. So in other words, they don't come with the risk of hypoglycemia. When the sugar levels are normal in the blood, they will not lower blood sugar. So this is a big advantage compared to other medicinal products for type 2 diabetes. Another advantage is that 90% of people living with type 2 diabetes are actually also living with obesity. So people with obesity and people with type 2 diabetes have both a problem with managing their weight. And this drug, at the one hand, it controls your sugar, but on the other hand, it also leads to weight loss. So that's something that is beneficial in these people. On the other hand, it is a medicinal product, so we shouldn't use it lightly. And the fact is that we usually use it when a first-line treatment with lifestyle changes, or metformin, a very old and very cheap drug for the treatment of type 2 diabetes, when those interventions fail, then we go to the GLP-1 class. And people should really be counseled when using these drugs, because if you keep on eating too quick, or if you drink with your meals, you'll often have troubling side effects of feeling nauseous, which make it hard to tolerate the drug. And so it is important that your diet is adapted to this drug. A healthy lifestyle is good for everyone, but also for people living with diabetes and type 2 diabetes and obesity. And so it is important also to counsel the patients on how to properly eat and move so that they don't lose enough lean mass, for example.
So I see there's a question on kind of what should people eat, what should people look out for if they are on this medicines in terms of both exercises and diet.
So especially in the beginning, it's important to listen to your body, eat slowly, because people have a tendency to eat quickly, or lifestyles are pretty agitated usually. And so if you eat too quickly, you eat above your satiety. So you become, you don't feel your satiety coming and you overeat yourself, which will then give way to nausea. That's an important one. A second thing that's really important is that you should also increase the amount of protein in your food. And this is important because when you're losing body weight, you're losing on the one hand fat mass, which is what you want to be losing, but on the other hand you're also losing muscle mass. And in order to maintain your muscle mass, it is important on the one hand to do physical exercise, but on the other hand to really eat enough protein to maintain that muscle mass.
Thank you. I see a few questions already in the chat, so I think you've already spoken a bit about the side effects, but I reckon that it's important to remind people that, as you've just said, these are prescription medicines, that they are prescribed under the supervision of the doctor, that they're not something to be taken lightly, and perhaps you can expand a little bit on the side effects that people can experience and whether this is the right medicine for everyone or...
Well, first of all, it's a medicinal product and it should be used in the right patients. So the product should be used in those patients that have the condition for which the product is authorized and in which the product has been studied. So these are people that are overweight with health-related problems or that are living with obesity, and on the other hand, people with type 2 diabetes that is badly controlled, even when lifestyle changes have been implemented. Now, the side effects, as you know, the European Medicine Agency has a surveillance system for the side effects, and as this is an endogenous product, it's actually a hormone that we produce ourselves. There are relatively they're relatively safe drugs. So with now more than 10 years of experience, we see very little trouble, but what is true is that people, for example, that have a past of pancreatitis cannot use this type of drugs. People that have some very rare endocrine neoplasias, so cancers, cannot use this product. So it's always important to first discuss with your doctor, indeed, who is the best place to know whether this is a product that will be beneficial for you and whether the benefit risk in your individual case is indeed positive.
Thank you. And I think you've mentioned a little bit, but what would happen then if I stopped taking the medication, if we interrupt treatment?
Well, both for the start and the end of the treatment, it's important that that happens in a supervised way. So at the start, to not have too much nausea, etc., you should, for most of these products, increase the dose slowly until the maintenance dose. When you stop the product all of a sudden, you will usually regain weight, and this even despite the fact that you might have implemented lifestyle changes. So this is often something that is disappointing for people, and we all have that experience when we try to lose weight. Losing weight is not so much of a problem. What is the problem is keeping off the weight that we have lost, and this is because the human body is quite unique. In all species, you don't have this defense of body weight that we are capable of having. So when you lose weight, your body will react to that. Losing weight is actually an alarm signal for physicians. It means that something is going wrong if you lose weight without doing anything. And this is because of this property from defense of the body weight. So what will happen if you lose weight is that the metabolic adaptation will take place. So you're going to burn less energy, and your hormones, your gut hormones that I already talked about, they will also be regulated differently, so your hunger hormones will go up in an attempt to make you eat more. And so when you all of a sudden stop this kind of products, you usually see weight gain and as a result also a deregulation of your glycemia. And when you become hyperglycemic, you're at risk of developing all the problems that we usually see in badly controlled diabetes, kidney problems, eye problems. So it's really important that people know that this is a chronic treatment, that when they start the treatment, they realize that this is probably a lifelong treatment, and that if they want to stop the treatment, which is possible that they have side effects or something else, that they should talk about that with their doctor to see how best to do it.
Absolutely. And I guess that this is in general the case with anyone who is interested in kind of weight loss or making it, that actually the first port of call here should be the physician.
And this is something that's, we are seeing a shift in that. Now that we have new hope for people living with obesity and type 2 diabetes, because these drugs are kind of a game changer. I don't want to be promotional here, but they are a new class that's very promising. But what is important is it's chronic treatment for a chronic disease. And so it's important to realize that when you start a patient on this kind of treatment.
Very well. And I guess because of this, you know, you are supervised by your physician. You should not be getting this medicine in any other way. You should not be getting your medicine without prescription. This is not a medicine that will be given to you over the counter.
And this is something that we have seen in surveys of patients. So a lot of patients don't see their physician as helpful with a weight issue. It was a survey that was done in Belgium. Only 5% of people living with obesity actually consult their doctor about it and talk to their doctor about their weight issues. People look for help online, they talk to friends on what to do, etc. And the important message is that overweight and obesity are chronic diseases. Your first point to seek help is your doctor. He's the best place, not only because he needs to, he's able to prescribe drugs, etc., but also because he needs to assess what the effect of your overweight is on your health status. So you have people, BMI is not a perfect metric, so you have people with a BMI of 27, 28, 30, even 32 that have no health-related issues. They should not be on medicinal products to control their weight because their weight doesn't pose them a problem. And so what the doctor should be doing in the first place is to assess, well, is this weight, this extra adipositas in this case, is it a problem? Is there, like, for example, sleep apnea? Is there other side effects such as diabetes or cardiovascular disease? Or is this not the case? And only in the case where we see health-related problems should we treat people with medicines or surgery in extreme cases.
And I guess that this is important in the context that we find ourselves now with the shortages in Europe, but it's also important because of the impact that stopping treatment could have on diabetes patients, for example.
Yeah, and this is a bit of a struggle right now, also as a physician. So people have trouble sourcing the drug, and this is due to the fact that, well, obesity is extremely prevalent in the European population. This has been a pandemic that's been ongoing for more than 2, 3, 4 decades. So it's and so because of the high prevalence of the disease, and also the fact that they're quite complicated to make. So most of these medicinal products are injectable, so you need a supply chain that's quite convoluted. Companies are having trouble to keep up with demand. And so it's important right now that we try to make sure that people who go on the drug will have continuous delivery of the drug. And I already told you it's for chronic diseases, so you want people to be able to continue the treatment, because otherwise they're at risk of having hyperglycemia, they're at risk of regaining all the weight, which of course is not what we want to see. And so this is why we need to prioritize a bit the patients that are most at need right now. This doesn't mean that we don't see that other people might also benefit, but right now I think it's important that we indeed give it to those who are most in need. And that, of course, we work with all the stakeholders to make sure that this supply in the future will be continuous and sufficient.
And here, I guess you are speaking as a prescriber, but I mean, EMA in the past months has worked a lot with different stakeholders, with patient and consumer groups, with the pharmaceutical companies that make these drugs, and with other regulators at European level to really make sure that there is a concerted effort towards managing and handling this the shortage while it is ongoing. And actually, if you're interested in this, you can find more information on our website, and perhaps we can put some of the links of some of the recommendations that have been issued in the last couple of weeks on how to handle this shortage together as in a unified manner. But coming back to us, I read a bit of an incendiary question here, which is, why do we need a drug? Why can people not just use kind of diet and exercise?
Well, if things would be that easy, there would not be people living with obesity. So it's something that I have realized over the years, that usually people that have trouble managing their weight, it's really not, and this is something that we previously maybe emphasized a bit too much, this is not only their responsibility, often weight management is also something that happens through the hormones. I explained you there is balances in your body between hunger hormones, satiety hormones. These are all things that are outside of your will. So obesity is not the result of a lack of willpower to manage your weight. It's that something goes wrong in this hormonal regulation. And of course, and this is important, when you then repair this balance in hormonal regulation by adding a GLP-1 agonist, that doesn't mean that you don't need to do your diet. This is not an easy way out. So sometimes people tend to forget that. But when you treat someone living with obesity or type 2 diabetes and obesity with surgery or GLP-1 agonists, it's not the easy way out. It is actually something that requires of the patient that he sticks to a diet, that he sticks to exercise, because as we said before, otherwise the side effects of these drugs will be too big. And also, if you don't have a proper diet, if you don't move enough, you lose lean mass, muscle mass, which you don't want, but also you're at risk of developing deficiencies in some micronutrients, in some vitamins. So it's really important that this happens in a really well structured way, this treatment.
Thank you. I see a few questions here on side effects, but I think that we have expanded a little bit on this. Is there, before we log out, because I think this conversation actually went really quickly, is there anything that you would like to kind of really drill home for the people who are following us?
Well, I've already mentioned it, but the real drill here is to view obesity as a chronic disease. This is really something that has shifted over the past decade. And in a way, the discovery of this new class of drugs is a kind of opportunity to emphasize this. So it really shows like, okay, weight is regulated through very balances between hormones, neuronal circuits that are outside of the will of patients. So we really have to stop seeing people living with obesity as, oh, this is the result of a lack of willpower. People don't like being obese. They don't like all the consequences obesity has. So it's time to take this disease serious. That doesn't mean that we need to put everyone on a GLP-1 agonist. This is also very important. We don't have to over-medicalize the problem. We have to also emphasize prevention, etc. But in the end, we should help those who are sick. This is our primary role at the European Medicine Agency. And so I think the real message is view it as a chronic disease, and we need to help people with chronic diseases.
Thank you very much. So I see a few people in the chat asking if this will be recorded. So we are recording this conversation. We are not sure how we will post it, but we will post it. So keep following. And thank you very much for joining us. Thank you so much, Bart, for this chat. It's been really interesting.